Hi guys, this is Amrit and I would like to welcome you to OsproEd. This video is for educational purposes only and please never practice medical skills without the proper credentials. Okay, so the topic in this video is called soap. No. Don't get the wrong idea. This is not washing soap or some kind of detergent. It's how to document patient assessment using SOAP notes, okay? So SOAP stands for subjective, objective, assessment, and plan. Okay, so look guys, I've come across a few bad happenings at various workplaces where foreign trained doctors go through like a hard time with local staff members, and this is mainly because they don't have a proper structure in documentation and also handwriting that is sometimes not very well understood. And this is why I'm making this video. Communication in the medical setting is very important. Verbal communication as well as written communication. So keep in mind, when you write your notes, they become a legal document and you are held liable if things go wrong. Your notes should reflect your thought process. So say, for example, you're assessing someone with a headache. So headache is the main complaint and you have not documented symptoms or signs, looking for differential diagnosis or red flags. And say something horrendous happened to this patient. The only thing that will save you in a coroner's court is your documentation. Documenting red flags or things like no vomiting, no blurring of vision, no dizziness, no fever, no chills, no neck stiffness, nil neurology. So be careful not to miss key important things in documentation. Okay, be professional and be respectful in your notes. Even if the patient sometimes can be very difficult, can be annoying, and at times you feel like revealing and expressing the inner self of you and the way you feel. And remind yourself, this is not a private journal. Always be professional, okay? So not too long ago, I witnessed a heated discussion between an IMG and a senior paramedic in what was like a hospital to hospital transfer case in ED. And the handover notes that this IMG had written, they were in a handwriting that no one could understand. So guys, this resulted in like the paramedic staff getting furious and questioned like how am I going to look after this patient on a 4-hour journey, and I can't read a word of what the notes had. And this resulted in the IMG losing their face in front of all of the staff that were present over there. And news travels pretty fast. So before you know it, like everybody knows, right? So this IMG had to put in the same amount of effort and time to rewrite everything in a proper manner, and then finally the transfer happened. So long story short, learn to do things correctly from the very beginning. Think about like long term. Always think about long term, okay? You need to grow a chest of steel when you start working in the hospitals here, because things like this will happen. But in the biggest scheme of life, things happen, and they happen to teach us to be a better version of ourselves. So don't be afraid. IMGs have a lot of issues when they start working in Australia, and one of them is documentation. So documenting a patient's assessment or the notes, this is something like medical students need to start practicing very early on. And I'm not sure how it is like in your country, but I will talk about the SOAP framework. SOAP stands for subjective, objective, assessment, and plan. If you master this, I promise you will have structure and your documentation will always be in a clear and consistent manner. So let's see what SOAP stands for and how to do it. So S is subjective. So this is the history section, the HPI. So include symptoms, make sure it's chronological narrative of a patient's complaint, information obtained from other sources. If they are there, then say like it's the parent or the carer of the patient. You need to document their name and their relationship. Document the relevant past medical history. In subjective, you document how the patient is currently feeling and how they've been since the last review. And this is in their own words. If the patient mentions like multiple symptoms, you should explore each of them. You can be like making bullet points for each symptom or hashtag. I personally like hashtags, so I can do like hashtag headache, hashtag vomit, hashtag constipation, whatever. Have the patient describe the complaints in their own words. Let them do the speaking, and you should document the patient's responses accurately and use quotation marks if you're directly quoting something that the patient has said. For example, patient having a crushing 10 on 10 headache. So you can quote unquote that, okay? You can use mnemonics like the Socrates or Lot Radio or the old carts to provide like a smart way to cover the patient's condition more deeper. So always, try and dig deeper, go and you can, for example, use old carts. So in the old carts question, always the onset. So determine when each symptom first started. L is location. So find out like the primary location of the pain or discomfort. D is duration. Learn how long the patient has dealt with this symptom. C is characteristics. So examine the type of pain, like is it aching, stabbing? A is alleviating or aggravating factors. What actions or interactions reduce or increase the severity of the pain? R is radiation or relieving factors. So find out like if the pain radiates to other parts of the body. T is for timing or temporal pattern. So do the symptoms appear in a pattern like in the evening or at night or after meals or in the morning, whatever. S is for severity. So check the severity of the symptoms and always dig deeper and use like a mnemonic to help you, obtain a thorough history. Ask symptoms that are associated, like are there any secondary symptoms that accompany the patient's main complaint? With the client's symptoms fully documented, you can move to the next portion of the note. And of course, don't forget to write about the relevant review of systems and the current medications. So the list of the daily dose of medications, and if they have any allergies, make sure you document that as well. Okay, so O in the SOAP stands for objective. So under objective, you have things things that you can look, you can hear, you can feel, you can smell and calculate. So say like the physical examination or the vital signs, any relevant recent labs, x-rays, whatever that has been done at the visit. So say fluid balance assessment like NG fluids, IV fluids, urine output, any stoma output or drain output, you can document that there, okay? Moving on, A in SOAP stands for assessment. So in this section, it's like you write your assessment of the patient's problems. So when it comes to assessment, a one-sentence description of the patient's major problem, or sometimes it can be a problem list. So in that case, make a numerical list of problems that you have identified. Your goal is to document your impression on the diagnosis or differential diagnosis. So for example, I can be like, number 1, likely community-acquired pneumonia. Number 2, likely exacerbation of CCF. Number 3, functional decline. Number 4, hyponatremia. Number 5, left foot diabetic ulcer. Number 6, cognitive decline. So all listed problems need to be supported by findings in the subjective and objective areas above. Try to take the assessment of the major problem to the highest level of diagnosis that you can. For example, say my patient had 5 days of coughing green productive phlegm, shortness of breath and fevers with rigors. So I'm going to provide at least 2 differentials for the major new problem which I have identified. So I can use words like likely community-acquired pneumonia or likely that or cough for investigation, okay? If the diagnosis is already known, like for example, diabetes, and in the findings, in your assessment, you can see that there is a left foot diabetic ulcer, then you can comment on whether the patient's condition is clinically improving or is it getting worse. So I can write like left foot diabetic ulcer, and I can write old. Under that I will also comment on diabetes, say like poorly controlled T2DM with non-compliance of treatment. Okay, something like that. The P in SOAP stands for plan. So your plan for the patient. So this is based on the problems that you've identified. Develop a diagnostic and treatment plan for each differential diagnosis. You should have a rationale for administering any treatment. You could be following, like, say, the sepsis protocol or the guidelines, which recommend you to do A, B, C. But you need to make sense, and you need to understand, like, hey, what I'm doing makes sense because of A, B, C, you know? Your plan section may have your diagnostic plan, which may include like tests or procedures or medications or VTE prophylaxis, maybe doing some lab studies, consultations or referral to a specialist, mental health, discharge planning, whatever. Your treatment plan should also include a patient education, if any other like therapeutic procedures. You must also address plans for your follow-up, like the next scheduled visit or things that you want the nurses to do, like hourly obs or like maintaining a strict fluid chart or bowel chart or daily weights, whatever it is that you want them to do, okay? So this was SOAP for you. I strongly recommend that you start documenting in the SOAP format from now itself and make it a habit. I hope this was useful information. If you're happy with this video, give it a thumbs up and do that by hitting the like button. I hope this video was useful, and don't forget to share it with your friends and colleagues. Until next time, look after yourself. Thank you.